Hello everyone, it's our honor today to have Dr.Nozer Sheriar join us. He's one of the most renowned gynecologists and obstetricians in the country. He's an MD in gynecology, obstetrics and gynecological endoscopy. He has over 30 years of experience of, helping women become moms. And not only become moms, but he's also one of the doctors that I know makes you feel empowered to be a woman. He helps us understand that how the healthcare community is there more to support us as we go through the journey from pregnancy to parenthood. He not only empowers you through the journey of pregnancy and motherhood, but also makes you aware of your rights as a woman. He touches upon topics about your right to abortion, to even the choices that you make as a couple post delivery about stem cell banking. He ensures that you know all about epidural, its pros and cons before you choose to have one. He also respects the choice that you make for a natural delivery versus a C-section. He informs you about all the things that you know in order to make an informed decision to define your journey of motherhood. Hello, doctor.
I am going to forget all this technology once the lockdown is over. Hi, honey.
No, doctor. This is the way we all can connect with you in spite of being from across the world and not only in Bombay. Thank you so much for joining us. Welcome to our world of technology. You know, when we come to you, we don't understand half of the words that you all are using.
So I think this is your way of getting back.
No. This is a way of, welcoming you to our world and helping
so
more
I
moms.
came onto Instagram about a month and a half ago because I did another interview. I'm getting to learn. I can't understand why things don't stay on forever. I suppose that's why it's called Instagram.
Yes, doctor. So, everyone, we are very happy to welcome Dr. Nozer Sheriar. He is, for me, one of the best gynecologists and obstetrician from Mumbai. He has over 30 years of experience. He's done his MD from King's Edward Memorial Hospital. Moreover, he's an amazing person. And I think what I would like to say is he really knows how to calm a mother down more than any of the degrees and, the qualifications that he has. So I hope all you mothers stay tuned in today to just see how pregnancy can be so relaxing when you just hear him say what you need to do and when you follow that. So I will just jump into the question, doctor, without losing any time. What are the things that, a pregnant mother in today's day and age and today's time with this amidst this pandemic should ensure and be aware of if she is pregnant or about to deliver?
So I suppose the elephant in the room is at the moment COVID-19.
Okay? Yes, doctor.
That virus has just taken over it. And the first thing I want a woman who's pregnant at this time to know is that these are very frightening and scary times, but they also have a silver lining.
Yes.
Now, the silver lining for a pregnant woman is that this virus, which is a horrible virus, which is a very infective virus, which, as you know, is a very dangerous virus, does not seem to pick on pregnant women. It is not more harmful for pregnant women. We now have many months of experience, almost the last 4 or 5 months of experience. Lots and lots of women have given birth. Now, I take you back to the previous pandemic of H1N1 about 10 years ago. When we dealt with H1N1, it is scary that 10%, 7 to 10% of the people who died were pregnant women. With COVID-19, that's not the case. With COVID-19, what we know is it does not seem to make the pregnancy more dangerous. It's as dangerous as anyone else. It does not seem to be transmitted to the fetus. It does not seem to be present in the amniotic fluid, vaginal secretions, on the placenta, or even the breast milk. So, be assured, you have to take every possible sensible precaution that the world has to take today and will have to take for many months to come. The physical distancing, the protecting yourself, the hand washing, the sanitizing, it applies to you as much as anyone else. If you have a comorbidity such as diabetes, hypertension, heart problems, you are at a higher risk. But having said that, the biggest challenge we are facing today at the moment, honey, is the fact that because of these constant, because COVID-19 has just taken over everything else. 80% of our hospitals in beds in Mumbai have been taken over for these patients. So we are fighting to keep maternity services safe, segregated, isolated, and available. I believe that since the lockdown happened, India has probably delivered close to 2.5 million women, and we will continue to do so.
Absolutely, Doctor. The statistics show that we'll have over 2 crores women deliver by December of 2020. So that's a huge number. And it'll be great to, for all of these women to know what you've just stated, that, COVID does not affect pregnant women as much as H1N1 did. I think that kind of answers my second question. How do you stay calm during delivery during this pandemic? So you've pretty much covered that. I'll straight move on to the next question, Doctor. Thank you for answering about the safety and the precaution that a woman should take during pregnancy. Doctor, just wanted to understand, because all these days and these years we've spent on the importance of scans during pregnancy, right? But during COVID, you want to limit the exposure, you want to limit stepping out. Not everybody might be having their own private vehicles to, go to a scan center. Also, a scan center's costs and, efficiency might not be that much in most places to change all of the, bed sheets to everything, so that, everything is ensured that it's safe. So what is the importance of scans, and is there any side effect or anything that a mother should be aware of, especially during these times? And if you could list top 3 scans that should not be missed.
Well, so the first thing to understand is we cannot compromise good basic medical practice. So you can't go through pregnancy without your basic important scans. You can't go through pregnancy without your immunization, and you can't go through pregnancy with your minimum antenatal visits. And to make these happen, we've got to change our way of practice, and we've done so, and we will continue to do so. Honey, just 1 second. Ruby. So as far as we are concerned, to do these things, we will have to change the way we work. Patients will have to change the way they consult us. The basic scans that you would generally have to do would be the nuchal scan at 12 weeks, the anomaly scan at 18 weeks, a growth scan at 28 weeks, and maybe a last scan at 36 weeks to tell us how things are going. Now, what we've tried to do is, every time a woman steps out of the house to do a scan, we've tried to couple it with an antenatal visit, so she gets a 2-in-1 trip out of work, right? So we minimize our antenatal visits, but you cannot do away with them. Please do not forget, pregnancies can have a lot of other problems, hypertension, diabetes, a whole lot of things which can be picked up only if you see the patient. The precautions that we will have to take is, we have changed the way we work, and we will continue to do so. We have to limit the number of patients at a time. We have to make sure that patients come at a certain appointment. Please do not visit your doctor's office with more than 1 attendant. When you go there, please be responsible, listen to people, maintain social distancing, keep your mask on at all times. Sanitizer, very important, and washing with soap many times a day, even more important. At the doctor's clinic, make sure that the doctor is following the basic precautions. And so what happens in the clinic is, you're constantly having staff sanitize surfaces, sanitize tables, sanitize the bed. If need be, put a sheet under you on the bed, so it makes it safe for you. As far as the ultrasound clinic is concerned, since the ultrasonologist spend so much time with you, they have to wear the basic PP for your protection and for theirs protection. Now, personal protection equipment could be as simple as a good mask, which is a many-layered mask or a cloth mask, or an N95, which basically medical people are supposed to wear. Everyone doesn't need to wear an N95. A face shield might be a good idea, and now you're getting more and more of very simple face shields, because that protects you when someone's talking to you, even if they are a distance away from any kind of fomites. So these are simple things for us to do. The ultrasound machine, the technologies that we use have to be managed differently. But what I want to emphasize here is please do not be afraid to go and get the care that is absolutely essential, because if you do so, you might actually be putting your pregnancy at risk.
Thank you, doctor, so much for that. Just one query we had from one of the mothers, doctor. It was more scientific. She was saying that the doctors and medical staff have been asked to take the hydrochloroquine tablets, but that is only advisable for 6 weeks. And we are over 6 weeks now. So how do we ensure that the doctors are safe who are treating us now? Are they all being tested?
So, first of all, this is slightly controversial, and there are very clear guidelines for hydrochloroquine. It is not to be used by all patients. It's not to be used by all pregnant women. In fact, it is not even to be used by all healthcare providers. Now, I'll tell you what happens in my life. Well, personally, I am not taking hydrochloroquine because the recommendation is, number one, you should be who works in hospitals where there are COVID-19 patients.
I'm really sorry, doctor. I think the network was lost. We last heard you saying that it's not to be taken by even all healthcare providers.
Right. So, honey, there are very clear recommendations for hydrochloroquine. Okay. So, I do use hydrochloroquine in my practice for a number of patients with something called as autoimmune disease. So, it's not a drug I'm afraid of, but it does not seem to benefit. Basically mean that this person should be someone who's got very close contact with the COVID-19 patient. It's a healthcare provider who is working with COVID-19 patients, or most importantly, it is someone who's COVID-19 infected. Right? So in my practice, I am not taking it because my patients are low risk and it has its own risks. But my son, who's working in a hospital where there are COVID-19 patients, is taking it because he has to deal with those patients on a day-to-day basis.
So coming to a very important question, doctor, unlike you, we've got questions from a lot of mothers where they are in their last trimester and the doctors have already scheduled their C-section deliveries. They're not even attempting for a natural birth. So just, if you could give some clarity to most moms here, the difference between C-section and natural birth, given, again, COVID times, because you might not have that much support to help you out.
Okay. So, firstly, having a C-section doesn't make anything better or safer. The question is sometimes logistics, because we are struggling now with hospitals insisting on a COVID-19 report just before a patient is. And obstetrics is unpredictable. Having said that, you can make it more predictable. So in the last, maybe this month, I've delivered 20 patients, and maybe half of those patients have delivered vaginally. But I had to change my practice. So basically what I do is, we do a COVID-19 test when I'm sure that she's quite ready for the patient to deliver. My phone. And once I'm quite confident that the cervix is favorable, I do a COVID-19 test and then I induce labor. And I deliver her vaginally. In fact, I believe that the vaginal birth has an advantage because, number one, she can go home sooner. And in this time, I want my patient to go home sooner. Number two, when she's having a vaginal birth, she can keep a mask on at all times, and even the anesthetist who's at the highest risk does not have to be at that high risk. So these are precautions. These are precautions that we will probably have to take, but I see no reason why a woman cannot have a vaginal birth at this time.
Thank you, doctor. Thank you for that clarity, because unfortunately a lot of OBGYNs are actually scheduling deliveries in order to ensure that all medical equipment, staff, etc. are in place and things get done faster. Unfortunately, that's happening, and that's the questions and concerns that we got from a lot of mothers. So you mentioned a little bit about the COVID testing. Is COVID testing now mandatory before one delivers? And what happens if one, if the person, if the mother is positive? And is it mandatory for the birth support partner, whether it's the father or the mother or the grandmother as well?
So we are working under very difficult regulations, honey. In fact, the most recent regulation of the government says that you do not test an asymptomatic person. Okay, so I'll tell you again what's happening in my practice. Hospitals are insisting that the woman be tested, which now I am doing reluctantly because personally I do not believe that India has the capacity of testing 2 million pregnant women each month before they
Absolutely.
don't have the capacity. Then what are we talking about? But since
Yes.
hospitals are insisting we are managing it for the pregnant woman, they were insisting on it for the accompanying person, which we are not doing. We are not allowed to do it, and I don't believe we need to do it. Okay? And she goes back to her environment. But what is very important now is what I call a triage, a phone triage. A triaging means I identify.
Absolutely. Talking about the importance of triage and what you do in order to avoid COVID testing for
That's right.
mothers, because we don't have the capacity or the training to, do
Absolutely.
COVID testing for each and every mother or their partners who are supporting them through birth.
So you can do triage at different levels. One is you can do a self triage, where you look for certain symptoms, and those are very well published and they are there. It's fever, it's a cough that's kind of persistent, it's breathlessness, it's difficulty, climbing stairs and speaking. And recently they've added another symptom, that's loss of smell and loss of taste. You could do a phone triage. When you go to a doctor's clinic, we usually check with patients as to whether they traveled, what kind of symptoms do they have, and give them simple instructions. When they come to the clinic or the hospital, then a temperature check is done with an infrared thermometer. That's part of the triage, a history. And what we normally do is we get a patient to sign a declaration. Now, the idea of doing this is people unintentionally might forget a symptom, but when they see it in writing, it's a lot easier. So triage helps, and I personally believe, honey, that a woman who's pregnant, most women who are pregnant, are probably the safest patients at this time because they've got such a vested interest to be careful. In fact, I'll tell you of a very interesting experience now. I'm seeing fewer patients with other fevers, flus, colds, diarrheas, because patients have taken to a very healthy lifestyle. They are washing their hands more, there's less physical contact, and in effect, a kind of a byproduct has been that when you're trying to avoid the COVID-19 virus, you're ending by preventing a lot of other diseases, which is actually a very good thing and which is a lesson for us to learn as we go along.
Sure. I mean, we are seeing India so disciplined and diligently following rules for the first time. I could have never imagined like Mumbai could follow rules like the way we have
Yeah,
been. So it is
yeah.
really a behavioral change that has happened. I think it's going to be a new reality that we live in. And I hope this continues as we go forward. There's cleanliness, there's no dirt on the road. It's amazing how things have changed. Doctor, wanted to ask you, a couple of mothers have asked about the quad marker test. And if you've already done an anomaly, do they need to get the quad marker test done?
Okay. So this is my opinion. For me, the dual marker test is far more important because it's done earlier and it's got a higher sensitivity. If a dual marker test is normal in a woman who is a younger woman, less than 35, and a nuclear scan and a calculations are normal, I do not believe there is a place for doing a quadruple
Sure.
marker. The anomaly scan is absolutely important. They are looking at two different things. The dual marker and the quad marker are looking at risk of genetic problems, particularly the trisomies. The anomaly scan is looking for structural problems. So they are both equally important. The anomaly scan is best done at 18 weeks, but can be done till 20 weeks. There's a certain practicality to that. By 18 weeks, you will see a majority of what you need to see. And remember, in our country, we have a law which allows us to terminate a pregnancy up to 20 weeks. So we'd like to make a diagnosis of something very, very bad, very significant before that. There is another ultrasound which is done at 22 weeks, which looks at the baby's heart. It's called the 2D fetal echo. But we do not do that for all patients. We do that for patients where there might be some suspicion on the anomaly scan or something that makes them high risk for a heart problem. So all these scans are important. These tests are important. We are doing a specific diagnosis and they each need to be done in their own. 12 weeks dual marker or an NIPT, 18 weeks anomaly scan, and if needed, 22 weeks a 3D scan.
Thank you, doctor. So, doctor wanted to address a very important question, which is almost a decision, which I know you leave it for parents to make it by themselves. It's more of a choice. Is about the big question about stem cell banking. So, one, is it mandatory? What are the benefits? And for a lot of moms who've joined us today who are not from cities like Bombay, Calcutta, or Chennai, where the stem cell banking services are, the banks themselves are there. With the flights being closed, it's taking 7 to 8 days for the container to actually be received by the bank. Is it even a good time to even think about these questions, rethink about the decision of stem cell banking? What's your opinion?
Right.
I know it's just an opinion, but
so firstly, stem cells are primitive cells which have the capacity of doing a lot of good things. And the stem cell banking that we are doing is the cord blood stem cells, which are to an extent already specialized. So most of the time, these stem cells are going to work for hematological, meaning for blood disorders, a leukemia or a thalassemia or such other disorders. So if someone tells you this is going to cure diabetes in the family, I'm sorry, it's not. Maybe in future we'll have stem cells which will do that, but not these. So stem cell bankings are something that have a place, but do you do them routinely? Well, you know my opinion. I always say I'm neutral. If I believed in stem cell banking, I'd make everyone do it. And I wish stem cell banking was like other blood banking. I wish there was a community bank. People have to pay a sum of money, which for many Indians is a stretch. Do they need to do it? Well, remember, most of the world does not do it. There is no harm in doing it, but there is nothing wrong with not doing it. I usually give people a number. Out of every 10,000 stem cell bankings at this point in time, maybe about 5 or 10 will be used or useful, right? So 10,000 people bank, 5 or 10 will benefit from it. Now, there are other options. After all, stem cells are available commercially. And one of the things banks are doing today are they're also convincing you to register for their community banking program, which is kind of an invitation. Should you be doing stem cell banking now? Well, for me, nothing has changed. If the bank can guarantee you that they can get your sample to their facility safely, I don't think it matters whether it goes in 1 day or whether it goes in 7 days. They are signing a contract, a legally binding contract to tell you they are going to deliver a service. It might be practical if you're in one of the metros to find out if the laboratory is somewhere close to home, preferably in your own city. The banking is nothing. I usually do the banking myself. I saw a question they're asking whether the person, I usually prefer that the person does not come in because I do not want too many people there. So we collect the blood, we give it to the person. And I know some hospitals have been pretty harsh. And one of the hospitals I work at doesn't allow them on the premises. And the poor husband has to take the kit that we've collected and give it to him at the doorstep of the hospital. So yes, you can do it. Please do your homework. Please do your research. No one bank is better than the others. If you believe that you need to do it, go ahead and do it. Your doctor will support you. But if you believe you do not think you need to do it, do not get pushed into doing it. Put your money to better use.
So one of the very important questions, doctor, I mean, there are a lot of moms today who are in the service industry and now with this new normal, they're working from home. And there is a question that is it even the right time to get pregnant? Because, it's a stress-free environment for a lot of people. So it's a funny question, but should they even try or is it a bad time to plan?
So firstly, honestly, that's again a question that people have to answer for themselves. I have had patients getting pregnant in the last 2 months. And interestingly, I have patients who've been grappling with infertility, who now that they are home, they are otherwise less stressed, who come with positive pregnancy tests, and we are thrilled about it. Okay, so I don't think that anything really has changed. I don't think a pandemic is the end of the world. I think people need to decide for themselves. As of now, there is no evidence to show that, say, unlike a German measles virus or a chicken pox virus, which is harmful to your pregnancy. And like I said, early days, but now this disease has been here since January, and we are almost coming into June. So we have more and more experience with this. If you decide ahead, absolutely no problem. But if you feel you want to wait, then please be careful, please be responsible. What's been disturbing for me is more than a few patients are coming who had unwanted pregnancies. And then they put off their decisions to a later time. And by the time they come to us, the pregnancy is a little advanced, which is not a problem. We'll still terminate it. But you need to prevent a pregnancy if you don't want one. Use contraception. You need to allow a pregnancy if you want one, and don't let this virus scare you away from doing that.
Can I touch on a controversial topic? I know a lot of women today might be joining us because they're expecting or they want to plan. But can you just speak or share your thoughts a little bit about a right of a woman's, the right of a woman to choose to abort the baby?
Okay. I'm just seeing there's a message on the screen which is asking about stem cell banking. Well, I agree with what this person's saying, but I also believe that people have a right to choice. And I have a problem when people get in the way of other people's choice. So you may have an opinion that stem cell banking isn't great. Let people decide for themselves. That's what I believe in. I also believe that yes, delayed cord clamping helps, but I believe that it's always best to be somewhere in the middle. Don't be an extremist in any way. Unfortunately, with women today, they are caught between two extremes. One group of people who are saying do nothing and do everything naturally, which isn't fair because women have to benefit from technology, and the other group who are using too much technology. Let it be about the woman, support women and couples to make their decisions. And as long as the decision is not harmful and has some science to it, the woman has the right to do what she wants. As far as women's rights are concerned, well, I'm very, very clear on that. My philosophy with pregnancy and my patients, or I believe any woman is, you know what, if she wants it, I want it. If she doesn't want it, I don't. Personal opinion of doctors has no role to play. It has to be completely unconditional support for that particular woman, and we have to make what she wants possible. Now, if she decides that she doesn't want to continue a pregnancy, there are many ways of doing it. There are very simple ways today of medical abortion. In fact, today, particularly in these times with medication abortion, I need her to come to the clinic just once. And that too because it's a legal necessity of some form filling. She does the medication at home, she aborts at home, and she goes on with a normal life. If she wants a simple surgical abortion, she comes to the hospital, goes home within 4 hours. And we've had a few cases in the last 2 months who've come pretty late because of other medical problems, an abnormal fetus or a fetus that kind of suddenly whose heart stopped. And we've terminated those pregnancies at 4.5 months. So let me put this here. Nothing changes. Don't let this pandemic change good medical practice. Okay, every doctor owes you a responsibility, and I'm sure will step up to the plate to give you what you want. But when it comes to something like terminating a pregnancy or continuing a pregnancy, at the end of the day, that decision rests on only one person, and that's the woman herself. And doctors, families, husbands, and societies have only one role: support the woman. People often ask me about this difficult choice, and I remind them that each year in the world, there are 56 million abortions. Each year in India, there are 15.6 million abortions. That's much. That's how much sisterhood there is amongst women. And when so many women are doing it with a lot of thought, a lot of care, a lot of sensitivity, I think we just need to support them.
Thank you, doctor. So for so blatantly, so politely making us feel empowered, where we almost half the time feel helpless. And that really inspires us, listening, coming from a person like you. As you told us, doctor, repeatedly in this conversation today, that this pandemic should not scare you, should not cause fear. There are a lot of women who've been going through the IVF procedure, and there are a lot of women who wanting to get pregnant using the IVF methods. Is it a good time for them, if they've not started it, to go through that process, or they should wait?
So I must give credit to our colleagues who are doing IVF that they have had very clear guidelines from their organizations. And these guidelines have laid down what they should and what they shouldn't do. And they voluntarily stopped work for the last 2 months. But now, finally, when the lockdown is coming to an end, and when we know that we are going to have to live with this pandemic for many, many months, if not the next year or two, they have started work in a very systematic manner. And they have thought out their protocols in a very systematic manner. When the lockdown and the pandemic first hit, the first thing they did was, there were some women who were in the middle of their cycles. They froze their eggs and they stopped there. And those frozen embryos are waiting to be implanted. Other women did not start their cycles. All fertility work came to a standstill, as did all elective work in medicine. Recently, in the last week or two, many clinics have started doing simple infertility treatments such as follicular studies and intrauterine insemination. And a few IVF clinics that I know have now started the stimulation protocols. And if a woman is waiting for treatment, maybe now is the time to actually do it, because she has brought her life to a kind of pause or a standstill. And this way she has something to keep her going, just so long as she knows that the clinic clearly tells her as to what they are doing to keep her safe and keep themselves safe. So I see no reason why a woman who is keen to start fertility treatment should not be starting it sometime around now.
Thank you, doctor, for that answer. Before we move forward, just one last question, which is related to, again, an invasive process, invasive surgery. A lot of women have sent us their question that we have planned a second child, about to deliver, and they want to know about tubal ligation. And should they get it done during this time? Can they wait? And are there any benefits to do it when you're delivering itself at the same time? And how to convince their doctors? I'll repeat myself, doctor. A lot of women who are pregnant with their second child at this point, they're asking about tubal ligation. So they're asking about tubal ligation when they're pregnant with their second child right now.
Okay. So firstly, standard practices shouldn't change. Yes, we had stopped elective surgery, but firstly, if a woman is having a second C-section and she wants to get a tube tied, of course she should. It doesn't make the procedure any longer or any more complicated. Suppose she is getting a mini lap ligation after delivery. Well, maybe during the initial time of the lockdown, people weren't doing it, and justifiably so, because that would have meant taking a woman to the operation theater a day after a delivery and doing a procedure which we were trying to avoid. But now that the lockdown is complete, I believe that we have to get on with work. Basically, we estimate that during this lockdown, India has missed doing about 500,000 tubal sterilizations. Okay? That's how much we haven't done. In fact, we estimate that because of this lockdown period and this initial interruption of services, India is going to see 500,000 extra babies being born, and is going to have to do about 1 million additional abortions. So life has been disrupted. Life is waiting to get back to normal. There was a wonderful quotation by Ruchir Sharma, who basically said that a lockdown is like holding your breath, right? There's only so much you can do, okay, before you collapse. We've done a lockdown. We've done all these things that were supposed to be done. But I believe in the coming weeks and months, someone who needs a sterilization should get it. Someone who needs an intrauterine device insertion should get it. Suppose you're hesitant to do your sterilization at this time now, why not get an injection of contraception? Why not get an implant put in? Why not get a copper IUD or a progesterone IUD done? The worst thing for you to do now is to be afraid, avoid protection, and land up with a pregnancy that you have to deal with one way or another.
Thank you, doctor, for that information. You've given us a lot of time today, doctor. I just wanted to ask you, is there any words of wisdom or advice you would like to share with most of our moms today and the moms who will watch this video post it's posted?
Right. So I'll start off with planning the pregnancy. Well, if you're planning a pregnancy, it's extremely important to start planning it right. You don't rush into anything in your life. Okay. Let's face it, if you're planning an occasion or your children's birthday party, you would plan first, plan your pregnancy. Get your pre-pregnancy tests done. Get yourself tested for certain infections like German measles and chicken pox, and for God's sake, take the vaccine if you want to. Once you're pregnant, please be calm, please be relaxed. Pregnancy is the most natural thing in the world. It is not a sickness, it's not an illness. Enjoy your pregnancy, right? You can pretty much live your normal life with a few restrictions here and there. We are living in difficult times, but when this wasn't there, women could do just about whatever they wanted. Be vigilant, listen to your body, and do not hesitate in getting in touch with your doctor or your provider if something doesn't feel right. Do not wait for tomorrow or day after tomorrow. Please speak to them when something happens, because you might be missing out something important if you wait for some time. Follow the basic precautions, but ask lots of questions. I have no problem with women going ahead. I know we these days joke about Dr. Google, and I sometimes joke with my patients. I've got this mug which says, please do not mistake your Google search with my medical degree. We are there to help you. It's your responsibility to do your homework, to do your background reading, and to come to us with a list of questions and get everything solved. And if something makes it better and safer, please do it. If a vaccine makes it safer for you, please take it. Influenza vaccine, the TD vaccine, the Tdap vaccine, extremely important pregnancy. Finally, when it comes to delivery, you don't run a marathon by waking up one morning. You prepare for it for many days and weeks and months. Start preparing for your marathon. Labor is a marathon. People ask me, is labor difficult? And I say, you know what? The only time in medicine we talk about things in simple English terms is labor pains. Labor means hard work, pain is painful. That's what labor is. But that's what women have gone through from time immemorial, and that's what we are there to help. You know, it's something very interesting that obstetrics is something unique to human beings. Animals don't need assistance to deliver their babies, but human beings do have difficult delivery. That's why we need obstetricians to help out. Let the labor be as easy and natural as possible, but make it about yourself. What also makes me very upset is people deciding, families deciding for the woman, some health expert deciding for the woman, telling her that epidural is bad for you. I mean, nothing can be further from the truth. But at the end of it, it should not be the doctor who decides or someone else who decides. The woman decides, do I want to go through pain? Do I want to experience it? Do I want to take the epidural? And yes, in my opinion, an epidural is probably the greatest medical advance there is for a pregnant woman. Please push yourself and go for a normal delivery wherever you can. Let me say vaginal delivery. Yes, sometimes it can be difficult, but the end result is something that will be greatly satisfying for you. A cesarean section, there's nothing wrong with it. It's a medical procedure. It's the most frequently performed surgery in the world, but it should be done when it is indicated because it has its consequences. And after delivery, when you have your baby with you, there will be a lot of doubts. Please remember that women have the genetic programming to be mothers. Animals don't read books to look after their young, and women don't need to do it as well. Ignore what other people say. Follow your gut instinct. the most important principle in the entire world is mothers can do no wrong. If it feels right to you, it is right. If you feel this is good for the baby, it is good for the baby. Even if a so-called expert tells you otherwise. And you do this, you enjoy every minute of your baby. Husbands are great partners nowadays. Okay, they have a very important role to play. I know we've only spoken about women. And what I'm really proud of is today, and I'm talking about a certain class of Indians, maybe the 200 million middle class or 300 million middle class. Husbands have become such a part of pregnancy. There was a time in my practice when I hardly ever saw husband, and now every woman comes and the husband is completely a part of that pregnancy. And yes, sometimes one husband once asked me what his role in pregnancy was, and I said, very important. Your role is that of a punching bag. Because she is going through everything. She needs someone to be there who is a sounding board and even a punching bag if required. And the husband is a part of the delivery process, and the husband is a part of everything. And together, you are going to bring the most amazing, amazing, magical thing into the world, and it's going to make your life something it wasn't before.
Absolutely, doctor. That was wonderful. That was inspiring. I'm sure it was overwhelming for mothers who are still yet to deliver. But yes, it is a beautiful journey. It is a roller coaster ride that we all go through. And all I want to say is thank you so much for giving the time today. Maybe next time we'll do a Zoom session so that it's open and it's more clear, so that there's no network issues that Instagram's throwing on us. But it was amazing, doctor, to hear you. It's always amazing to hear your perspective, not only towards the field of gynecology and obstetrics, but how you women should feel empowered and it's their right and it's their choice. And that's not something that I've heard most doctors or medical practitioners talk about. So thank you so much for making us feel not only safe and calm, but also empowered through this session. And we look forward to meeting you in person, hopefully soon. And all the women who've sent us questions, who are expecting, planning their pregnancy, please look out for this talk that Doctor has shared with us today. Dr. Nozer Sheriar, thank you so much. Once again, signing off.
Honey, thank you. Thank you on behalf of myself and all these people you've done this for. And thank you for being such a strong woman.
Thank you,
Caring
doctor.
mother.
It was only, doctor, I just felt that, there were a lot of women during this COVID who were resorting to, speaking to other mothers instead of experts to get the right question. And hence we started the First Parents, because I felt that every mother's experience is different. Every individual's experience is different. And they need to hear it from the expert. We're just trying to get the right information from the best experts possible, doctor.
Thank you.
Thank you, doctor. It was totally our pleasure. Thank you so much.